Common habits that increase the risk of cancer. Smoking is the leading cause of preventable deaths worldwide, said the reference material. It contains over 7,000 chemicals, including at least 250 known to be harmful, with more than 60 recognized carcinogens. Smoking is primarily linked to lung cancer, causing about 85% of all cases. It is also associated with cancers of the mouth, throat, esophagus, bladder, pancreas, and more. The harmful substances in tobacco smoke can damage DNA in cells, leading to the uncontrolled growth of cancer cells. Drinking alcohol in excess can damage cells and tissues in the body, explained the reference material. This increases the risk of cancer development. Excessive alcohol consumption is strongly associated with oral cancers, mouth-throat, esophageal cancer, liver cancer, and an increased risk of breast cancer in women. The mechanisms behind alcohol-related cancer risk include the breakdown of alcohol into toxic chemicals and its effects on hormone levels. Exposure to the sun's UV rays, especially without protection like sunscreen and protective clothing, can lead to skin cancer, warned the reference material. Taking simple precautions like wearing sunscreen and protective clothing can significantly reduce the risk of skin cancer. Occupations expose workers to carcinogens like asbestos, benzene, and formaldehyde, increasing their cancer risk. A family history of cancer, especially in first-degree relatives, can increase your risk. Some cancers have a genetic component, like breast and ovarian cancer in families with BRCA mutations. Infections caused by certain viruses and bacteria can increase the risk of cancer. For example, hepatitis B and C viruses can lead to liver cancer, and HPV is linked to cervical and other cancers. Ionizing radiation from medical X-rays, nuclear accidents, or occupational exposure can damage DNA and increase the risk of cancer, particularly in the affected areas. Long-term use of hormone replacement therapy in postmenopausal women has been associated with an increased risk of breast cancer. Being overweight or obese is a risk factor for various cancers, including breast, colorectal, and pancreatic cancer. Fat cells can produce hormones and chemicals that promote cancer growth. Factors that influence cancer risk. Cancer risk increases with age. Over time, DNA damage accumulates and the body's mechanisms for repairing that damage may become less effective. Certain cancers are more prevalent in one gender over the other. For instance, breast cancer is more common in women, while prostate cancer is more common in men. The incidence of certain cancers can be influenced by geographic location. Skin cancer rates are higher in regions with intense sun exposure, while lung cancer rates can be affected by smoking prevalence in an area. Apart from smoking and diet, lifestyle choices such as high stress levels, lack of sleep, and exposure to secondhand smoke can contribute to cancer risk. Changes in hormonal levels, such as those experienced during menopause, can influence the risk of certain cancers, including breast and endometrial cancer. Certain professions may expose individuals to cancer-causing agents. For example, asbestos exposure in construction or radon exposure in uranium mining can increase risk. Having had cancer in the past can increase the risk of developing a new, unrelated cancer. Radiation therapy used to treat cancer can damage healthy cells as well, leading to a secondary cancer developing years after treatment. Understanding cancer risk factors and prevention. Cancer is a complex disease with many influences, but we can take steps to lower our risk. By adopting a healthy lifestyle, we can reduce our risk of cancer. Quit smoking, eat a balanced diet, stay active, and protect yourself from excessive sun exposure. Regular checkups and screenings are crucial for catching cancer early. Early detection leads to more successful treatment outcomes. Stay informed and make mindful choices. Stack the odds in your favor by understanding the risk factors and taking proactive steps to prevent cancer. Remember, many people with risk factors never develop cancer. Even those with a family history can reduce their risk through a healthy lifestyle and regular medical